Hi, everyone, and welcome to our Week 4 ME2550 lesson. I'm Instructor Oliver. I hope this far you have been enjoying the course and all the interesting information you have been learning. Today, though, we'll be focusing our attention on our two main topics for Week 4. These two very important topics are Medicare and Medicaid healthcare coverage. Many times during Week 4, many of the students who are not familiar with these two health plans usually reach out for clarity, as they tend to get them a bit confused. Maybe it's because both coverages share similarities in their names, or they have a family member that participates in one of them, or maybe in some cases they might know someone who participates in both. So I'm here today to explain both plans in an effort to help you understand what each of them are and what each of them offer. So let's get started. Okay. So we'll begin this presentation by reviewing the Medicare program first. We will talk about Medicare and what it actually is, who would be eligible to participate within the program, and what exactly makes up the Medicare program itself. So let's dig in. What is Medicare? Medicare is a federally funded healthcare program that was implemented back in 1966 under the Social Security Administration and President Lyndon Johnson's administration, and it's now currently administered by the Centers for Medicare and Medicaid Services, otherwise known as CMS. It is the largest healthcare plan in the United States, and as of 2019, 61 million people were enrolled in the program. That is a lot of lives for a healthcare program to have and be responsible for. So that takes us to our next slide. Who is Medicare eligible? Medicare was instituted to provide healthcare coverage to those 65 years and older, individuals younger than 65 who suffer from a disability, and for those individuals suffering from end-stage renal disease. Those that are 65 and older are generally eligible to receive Medicare Part A and Medicare Part B if they are a United States citizen or a permanent legal resident who has lived in the United States for at least 5 years in a row. Individuals younger than 65 years of age can also qualify if they meet the citizenship legal residency requirements and have any of the following qualifying circumstances. So those circumstances would be if they have been receiving Social Security disability benefits for at least 24 months in a row, if they've suffered from Lou Gingrich disease, which is also known as ALS, or if they have permanent kidney failure requiring regular dialysis or a kidney transplant. This condition would also be known as end-stage renal disease, and that's why it's included in our slide. Okay? So what are the different parts or components to Medicare? There are 4 sections, or better yet, coverage that Medicare offers. These options are divided into 4 parts: Part A, Part B, Part C, and Part D. And I hope this all sounds familiar to you because it's all included in this week's reading, correct? So as we move forward, hopefully this will resonate with your weekly reading. So giving the enrollee or the member these options give them an option or a bit of wiggle room into which part will work best for them and their medical and financial needs, right? But for the most part, once an individual meets the qualifications and is enrolled into the Medicare program, they will be enrolled into the original Medicare, which would be Part A and Part B. So let's talk about those. So Medicare Part A serves as a hospital insurance. So this portion of Medicare helps to pay for inpatient care in a hospital. So it would cover hospital admissions, for example, or for limited time at a skilled nursing facility following a hospital stay. Part A of Medicare would also pay for some home health care and also for hospice care. Okay. Once the member's enrolled in Medicare Part A, they usually are enrolled in Medicare Part B, right? As mentioned before. And Medicare Part B serves as medical insurance. So this type of coverage helps pay for services from doctors and other healthcare providers. So outpatient care, office visits, things of that nature, home health care, durable medical equipment is included in this, and even some preventative services. But keep in mind that even though Part A and Part B coverage sound pretty well-rounded and inclusive, this coverage will typically require for the member to purchase additional secondary insurance or pay out of pocket, which can be a bit stressful for most folks, especially the elder, as Medicare Part A and Part B will only cover up to 80% of the allowed fee, leaving a 20% deductible to the member to pay, right? So that would be an out-of-pocket payment. Because of this, Medicare has added Part C as an option for their members. So Medicare Part C, which is also known as the Medicare Advantage Plan, right, is a plan or are plans that are privately owned that are run through Medicare that by law must at least be equivalent to regular Part A and Part B coverage. In other words, they must follow the rules set by Medicare. This type of coverage can sometimes even include prescription drugs and additional benefits such as vision, hearing, and dental. These services are many times bundled into these type of plans. The last type of coverage offered by Medicare at a premium to the member is the Part D plan. Medicare Part D is considered the Medicare prescription drug coverage or plan. This plan was implemented in 2006 and it helps cover the cost of prescription drugs. Okay, so in essence, Part D will pay for any prescription drug that is prescribed to the patient with minimal out of pocket to them, depending on the prescription. Okay, so this basically covers our overview for the Medicare program. Now let's move on to discuss Medicaid. So what is Medicaid? Okay, so we're going to look at what Medicaid is, who is Medicaid eligible, and what services are included within the Medicaid program. Okay, so Medicaid, unlike Medicare, is a jointly funded health insurance program funded by both the federal government and the state. Medicaid and its rules are individually crafted depending on the individual state as the states follow the federal requirements, as long as the states follow the federal requirements. This type of healthcare plan was created to help those in financial need to receive needed and necessary medical services. It has assisted many low-income and needy families and children throughout the years. Individuals who are eligible for Medicaid must meet certain criteria set by each participating independent state. So each state is responsible for adding what they feel should be the criteria for a person to participate in their Medicaid program. But in essence, those who qualify normally are usually from low-income families. So each state has its own threshold of what the maximum income for an individual and for a couple needs to be in order to qualify for Medicaid. Since each state has authority over the eligibility requirements, monthly income requirements differ from state to state. So, for example, an individual would have to meet a certain monthly income to qualify for Medicaid in my home state of New Jersey. An individual's monthly income must be below $1,063 a month. A couple would only be allowed $1,437 a month to qualify for Medicaid. If they exceed those two amounts, they would not qualify. Okay? Now, there's a difference between New Jersey, for example, and let's compare it to New Mexico. An individual in New Mexico would need a monthly income of no more than $783 a month. For a couple, they would not be able to exceed $1,175. This shows how different the financial qualifications are from state to state. Others that would qualify for Medicaid would also be needy children, pregnant women in financial need, the elderly, and people with disabilities. Medicaid coverage, what's included? So Medicaid, similar to Medicare in what's covered is they're very different, right? So Medicaid covers a wide range of medical services, such services as hospital admissions, physician office visits. They do cover diagnostic services, pediatric services, and even transportation for medical care. In some cases, depending on the need, and if the member is willing to pay a premium, some Medicaid programs will also offer prescription drug coverage, therapies such as physical therapies when medically necessary, and even dental services. Okay, so you can compare the differences within the slides between Medicare and Medicaid to see that Medicaid, in essence, there is no fee unless you pick the optional benefits comparatively to Medicare, which has different requirements to be able to participate within it, and who does carry a deductible and in sometimes premiums, depending on which plan you go with, right? So the next plan I wanted to talk about is the Children's Health Insurance Program, otherwise known as CHIP, okay? And basically, this program was set up and implemented back in 1997, and it's administered by the United States Health and Human Service Department. The Children's Health Insurance Program provides health coverage to eligible children through both Medicaid and separate CHIP programs that participate, and it is jointly funded by the individual state and the federal government. The goal of this program was to offer uninsured children and families with incomes that are modest but too high to qualify for Medicaid healthcare coverage. All 50 states, the District of Columbia, and the territories have CHIP plans. Okay, so it's pretty popular within our country. So I hope this overview was helpful, and this concludes our week 4 topic. Please feel free to contact me with any questions. Have a great day.